March 13, 2020. It started as a normal Friday school day. We were told we would be taking a short leave and would soon be back. No need to worry about clearing out our lockers and cubbies. Just grab the necessities and we would surely return. But we were gravely mistaken.
This pandemic
level
has
are you
taken a
concerned?
major
We're
toll
about
on
to
young
stay
people.
This would in fact not be a short vacation. We would end up spending the next 2 years in a global pandemic known as coronavirus.
This pandemic began spreading throughout the country, and all of America would be forced to mask and quarantine away from those who we cared about. Over 1 million Americans would end up losing their lives to this disease, and if it wasn't the physical sickness, the mental fatigue caused by the isolation was taking its toll as well.
It turned places of celebration and congregation into ghost towns of mourning. And for us as kids, it meant we would go away from our friends and teachers.
You can hear the anxiety that echoes down empty hallways. The rooms are dark as the bright young faces that should fill them are now confined to boxes on a computer screen.
The constant state of fear, and even loss and grieving for some, started leading to mental health problems on top of the stress and tension of remote learning. About 1 in 5 kids would end up showing signs of depression and anxiety. Not only this, but COVID took away public, safe, and conducive environments for people in need. So with that being gone, some kids could not get access to the resources they required for remote learning. Because of this, our generation was left with a number of kids who academically fell behind during COVID, and the gap created within schools of high and low poverty grew between 20% in math and 15% in reading. When we returned, the forced normalcy did not help with bridging this evidently clear developmental and emotional gap. That's exactly why we, as newly elected Congress members, would make it our first priority to mend the gap created educationally and socially in youth by the COVID-19 pandemic.
We asked middle school teachers Caitlin Montgomery and Alex LeMay if they saw any changes in their group of students coming back from COVID.
Did you see any behavioral changes in students socially and mentally during and after COVID?
The largest one I could think of is the lack of maturity. When there was conflict between individuals or groups of individuals, they had a very hard time managing that conflict. They were not able to express how they were feeling. They were struggling. And past that, anxiety was very high. Being sent home for everyone's safety and health really did a number on people.
How has your experience teaching differ from when you came back to in-person school from what you expected it to be?
Well, we initially were told, get ready for learning loss, help getting them caught up, talk to the teachers from the prior year. And it's not so much the academic learning loss, it's the social emotional development piece. The year coming back was an exhausting, constantly in motion, reframing, refiguring process. But, we're doing what we can.
Mental health skeptics might say that these critical health issues plaguing our youth are just parts of growing up, or all in their heads. U.S. Surgeon General Dr. Vivek Murthy shares some statistics on the severity of youth mental health and how it has changed due to the pandemic in the USA.
What COVID did is it really pulled back the curtain on just how severe the mental health epidemic is in the United States, particularly among youth. There are 3 numbers that always stick in my head. The number 11. That's the number of years it takes on average for a child to receive treatment after developing symptoms. The second number, 57, that's a percentage increase in the suicide rate that we had among kids in the decade prior to the pandemic. And the other number that I remember is 44%. That's a percentage of high school students who say they feel persistently sad or hopeless. Half of high school kids are feeling despondent about themselves and about the future.
These skeptics might also believe that such funding could be used on other matters of more importance and actuality. However, experts like Sharon Hoover, the co-director of the University of Maryland-based National Center for School Mental Health, say, nearly every child in the country is suffering to some degree from the psychological effects of the pandemic. Suddenly, everyone is talking about mental health. Parents, teachers, and students are openly discussing it. That's why schools need to invest now in the mental health and well-being of our kids in a broad and comprehensive way, not just for students with learning disabilities and diagnosed mental health conditions, but for all students. To be able to properly invest in these students, we would first need the resources to. In order to help students, especially in regards to mental health, we would need in-school professionals, and according to the National Association of School Psychologists, it is heavily suggested to have 1 psychologist to about 500 students. And out of all of the states in the USA, only Maine meets the standard. Instead, the average of psychologists to students in America is 1,211 to 1. If we were newly elected Congress members, we could aim to combat some of these damages by providing a flood of both funding and services, like more grants to school systems to recruit in-school psychologists and implement not only Common Core, but educationally enriching programs and curriculums.
These programs would target youth who have suffered the effects of remote learning and focus on how to nurture and increase their academic proficiency. Studies have also shown that 1 in 7 students suffer from a mental disorder, including depression and anxiety. So outside of funding, we would press for the coverage of mental health care by public health insurance. These underserved children and teens will be the next adults of this world, after such a traumatic global experience. We mustn't try to immediately move on and attempt to discount the depths in which this has affected youth. We have to talk more about these subjects and understand their profundity, so we can assist in the ways that are truly needed to help salvage this lost generation.